Doctors are seeking protection against a broken healthcare system. This time last year, the Minister of Accountability, Transparency and Transformation said the new whistleblower legislation will cover healthcare professionals and set a gold standard. Justice Verdes disagrees and has recommended expanding whistleblower protection to include physicians. Will the minister explain when this government will bring forward legislation to protect doctors and frontline professionals from bullying and intimidation?
Honourable Minister.
Mr. Speaker, I'm very proud of the whistleblower legislation we brought forward. It does protect many classes of people. One of the difficulties I have when I listen to the questions from the opposition is they do not read the legislation before they ask questions. I would encourage them to do that. They will find the answers in the legislation.
Honourable member.
I guess the judge didn't read it either.
Mr. Speaker, I'm speechless that this minister doesn't even know his own legislation. Totally speechless. Given that this is just another good example of a government that doesn't listen, as this minister knew from the start that doctors were not protected under his own gold standard whistleblower legislation, can he please explain to Albertans why doctors who are trying to protect our patients were kept off the list?
Mr. Speaker, one of the difficulties whenever we're asked questions is that I don't think they've done their proper research. They need to start doing the research before they ask questions. There are medical professionals that are covered under the whistleblower legislation. Our whistleblower legislation permits any report to be made to the Public Interest Commissioner. And I would encourage them not to present false accusations in this House, not to fearmonger, but to do their research, look at the legislation, and then they're going to find their answers.
Mr. Speaker, quite frankly, this is embarrassing. Given Justice Verdes said in his report that advocating within the healthcare systems for patients is a basic function for a physician, and that physicians have a responsibility to consider the well-being of society in matters affecting health, will the minister please commit today to bringing forth legislation that protects doctors in this fall session?
Just to assist the member, I'm just going to read a couple of the sections of the Act under Schedule 2. Medical staff means a physician appointed by a public entity designated under Section 2 of Schedule 1 to admit, attend, or treat, or who utilizes the resources of the public entity in respect of patients. Professional staff means a health practitioner other than a physician who is regulated under a health profession statute. So they are covered. They are covered. You need to start doing your research. Do your research before you ask questions in the House.